How common is anorexia in schizophrenia patients? Anorexia nervosa is a serious eating disorder that affects many individuals. But how does it relate to schizophrenia? Let's break it down. Research shows that anorexia nervosa occurs in about 1% to 4% of individuals diagnosed with schizophrenia. This rate is similar to what we see in the general population. However, it might be less recognized in schizophrenia patients due to overlapping symptoms. Symptoms of anorexia in those with schizophrenia can be tricky. For instance, fears about food, like worries of food poisoning, can be mistaken for psychotic features. Additionally, appetite loss related to depression can complicate the diagnosis. This overlap makes it hard for healthcare providers to identify anorexia in these patients. Eating disorders, including anorexia nervosa, often coexist with schizophrenia. Some individuals may develop anorexia before experiencing psychosis. Others might face it during active or residual phases of schizophrenia. The restrictive eating patterns typical of anorexia can look similar to behaviors related to schizophrenia, such as obsessive thoughts or delusional beliefs about food. There is also research suggesting a possible genetic connection between schizophrenia and anorexia nervosa. This indicates that both conditions may share some neurobiological factors. Furthermore, antipsychotic medications, which are commonly used to treat schizophrenia, can influence eating behaviors. These medications may lead to weight gain or changes in appetite, adding another layer of complexity to the situation. From a clinical standpoint, recognizing anorexia nervosa in patients with schizophrenia is essential. It requires careful screening and a team approach to treatment. This team often includes psychiatrists, therapists, and dietitians, all working together to address both the psychotic symptoms and the eating disorder. If anorexia is not recognized in schizophrenia patients, it can lead to inadequate treatment and poorer health outcomes. While anorexia nervosa affects a minority of schizophrenia patients, its detection is challenging due to the overlap of symptoms and the complexity of comorbid presentations. Awareness and specialized assessment are key for effective management in this population.